Hello everyone, I am Dr. Ravi Koti Reddy, Urologist working in Kamineni Hospitals, King Koti Branch, Hyderabad. Today I am going to talk about urinary tract infections in pregnancy. Urinary tract infections incidence increases in pregnancy due to some physiological and anatomical factors associated with pregnancy, and there is 2 to 20% increase in urinary tract infections during pregnancy. The risk factors associated with urinary tract infections can be divided into anatomical risk factors, where there is a hypotonic urinary bladder, a distended ureter, incidence of ectopic pelvic kidney, incidence of a vesicoureteric reflex. The physiological factors associated with increased progesterone during first trimester of pregnancy causes smooth muscle relaxation of ureter and bladder, and there is stasis of urine in urinary bladder due to hypotonic bladder, and also a distended ureter, and there is also high chances of vesicoureteric reflex. And low socioeconomic status, diabetes mellitus, sickle cell disease, and increased sexual activity during pregnancy. All these things are the other factors which also increase the incidence of urinary tract infections during pregnancy. The definition of urinary tract infection is defined as isolating more than 10 to the power 5 colonies of a single bacilli, gram-negative bacilli, and can be classified into asymptomatic bacteriuria when there are no symptoms associated with it, and this asymptomatic bacteriuria can progress into a complicated acute pyelonephritis in 2 to 20% of the people. Symptomatic urinary tract infections is defined as having more than 10 to the power 5 colony forming bacilli like Escherichia coli, Klebsiella, Proteus, Enterobacter, and having symptoms like frequency of urination, urgency, pain during urination, passing blood in the urine, pain in suprapubic region, and or acute pyelonephritis, which can be defined as high grade fevers, pain in the loin, nausea, vomiting, apart from other urinary tract symptoms as described in cystitis. So coming to the diagnosis, as already described, a complete routine urine examination can be done, where we can see pus cells more than 5 in number, and leukocyte esterase positive and nitrite positive in case of gram-negative bacilli like Escherichia coli, Klebsiella, Enterobacter, and even in case of nitrite negativity, we have to rule out urinary tract infections with gram-positive cocci like Staphylococcus and group B streptococci. Coming to the other advances in or evaluation of urinary tract infection is urinary tract biome, or where the bacterial genome can be detected. In normal urinary tract infections, culture can be negative, but biogenome we can get 100% accuracy in detecting the organism. Coming to the treatment part, as urinary tract infections can cause preeclampsia, can also cause anemia, can also cause preterm birth, intrauterine growth restriction, and other complications. Even asymptomatic bacteriuria should also be treated. This is a precarious situation where asymptomatic bacteriuria where culture positive but patient has no symptoms. She requires treatment because of the complications that might occur in 20 to 25% of the women. It can be a complicated acute pyelonephritis leading to preeclampsia or causing preterm birth, low birth weight baby, intrauterine growth retardation. There are certain antibiotics which have to be used. Commonly used is ampicillin or amoxicillin. The treatment duration is 7 days in asymptomatic bacteriuria, and the treatment duration is 15 days in case of acute pyelonephritis. In case of drug resistance, then phosphomycin or trimethoprim can be used. Trimethoprim is contraindicated in first trimester, and nitrofurantoin is contraindicated in last trimester as it might cause hemolysis. A word about group B streptococci, which will be negative in normal routine urine cultures as it does not convert nitrate to nitrite. In case of group B streptococcus positivity, there is chance of this infection being transmitted from mother to child. So IV antibiotics are given 4 hours prior to delivery. So urinary tract infection is a simple thing which is treatable, which can be preventable, and which is causing 20 to 20% increased complications in a pregnant woman as well as to the child. Things or precautions we have to take to prevent recurrent urinary tract infections in case of pregnancy, as in also a normal population. We have to drink adequate liquids so that urine output will be 2 liters per day, and taking more of fruits and vegetables, passing or urinating frequently 2 to 3 hours during daytime. And in case of malnourished people, taking balanced diet and gaining good immunity by taking good fruits and food. And in sexually active people, taking antibiotic before an intercourse on demand so as to prevent asymptomatic bacteriuria and complications associated with asymptomatic bacteriuria. Thank you.